Perspective on Florida Gateway College Television is sponsored by Potash Corp of White Springs. Potash Corp, helping nature provide.
Hello everyone and welcome to Perspective. This is a public affairs presentation of Florida Gateway College. My name is Mike McKee and my guests on the program today are Jody Witt. He's a registered nurse and director of emergency services and the emergency department at Lake City Medical Center. And we have Carl Harris, plant operations director at the medical center. They are here to talk about a new edition that'll be going online this month. In addition, they'll talk about how services will be improved at the Lake City Medical Center emergency room. We'll do that when we come back. Don't go away. You're watching Perspective on Florida Gateway College Television.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Welcome back to Perspective on Florida Gateway College Television. My guests on the program are Jody Witt. He is a registered nurse and director of emergency department at Lake City Medical Center, and Carl Harris, the plant operations director at the medical center as well. Welcome to the program, both of you. Thanks for being here. We're going to be talking about some new exciting things that are happening at Lake City Medical Center. I know we had the CEO, Mark Robinson, on the program, and how proud he was of the work you guys are doing, renovating and expanding the ER at Lake City Medical Center. Carl, that had to be quite an it's not something that just happened overnight. A lot of planning went into this, and we're about to unveil the first phase of this, correct?
Absolutely correct. We started the planning process back in 2012, actually, where we have a whole team of hospital folks and corporate people come on board, got together, decided what we needed to do to enhance our services and increase our capacity as far as square footage and building capacity. We actually had a planning process where we called a cast of thousands came in, and we had people from everywhere come together to plan this process. And we're using some pretty good techniques in making the design work. You can't do a cookie cutter for any building. Basically what we do is they have a cookie cutter that they roll out for us, and then we get our team together and massage it to make it work. And it really comes together at the end of the day that we've got a really very functional, very reliable ER that we can take care of our patients in.
What was the biggest concern that the people that you brought in? I know the folks who work at the medical center every day, the nurses and the doctors and the folks the patient care assistants that work in there, they had some input on what works. But were there people from the community that said, you know what, it's small? Was that their main concern?
We do have a size issue, and as we're looking at the volume of patients we push through our ER, we realize very quickly that we are undersized. And using the data that we have, which Jody can share with you, we made those decisions, and the volume of patients we see is great compared to the size of the facility we had. So we just made the decision we had to double the size of the ER to take care of the patient volume that we're seeing.
A lot of people go through the ER every year. Jody, I know that I was looking at the numbers, 26,000 people were seen at your ER last year?
That is correct.
Sorry, that is correct. We are very busy. We're one of the busiest ERs in HCA's company. So with that being said, we've seen the need that we needed to expand to give the community more beds, less of a wait time, and fortunately we were able to do so.
Well, and you got to talk. You're in a kind of a bad situation because you've got patients you've got to take care of, but you also have to staff folks that have to work in the ER to make it flow So you're kind of you're a little bit handcuffed there in the ER before this expansion took place.
It feels that way sometimes, correct. We're very fortunate that we have a good relationship with the college here, the nursing program, and get a lot of good, fresh nurses from that. But we're a good place to work. I think the staff really can attest to that, and we have a really good group of nurses. So recruitment's really not that hard. We are always looking for new ones, and we're excited about the new opportunities.
Let me ask you this, and this is we're probably going off topic. What kind of nurse does it take to work in an ER? Because there are different types of nursing for different parts of. I mean, you get geriatrics in a nursing home. You've got an operating room nurse. You've got nurses that are on the floor taking care of certain patients. But ER is totally a different animal, right?
It really is. Every type of nursing has its own, special type of nurse who feels it. For the ER, it's probably someone who's very assertive, loves critical care, doesn't mind the blood, the guts of the ER, but somebody with good time management, good prioritization skills, and somebody who don't mind being on their feet for 12 hours running.
Well, and in the case of an ER nurse, they've got to take charge, and most of the people are in immediate distress. I mean, if you're talking about a nurse that is on the floor, most of those folks are medicated and they've kind of got a handle on what's going on with their condition. But in the ER, you're kind of like, you don't know. Right. It's like a puzzle you're trying to put together. Talk about what kind of person it takes to do that, because you obviously like that kind of stuff.
Oh, I love it. We all thrive off of it, off the different types of conditions that patients come in with, that are of course time sensitive, whether it's your heart attack, your strokes. It's almost a challenge for the nurses to get in there and get this patient, treated, diagnosed within a certain amount of times. We're very fortunate. Like I said, we have a really good group of nurses, good skill mix. They're very strong, very knowledgeable about what goes on. And they're very used to taking care of these types of patients here in the community.
And when you're in a tight space, like, because I don't think we've told folks, there are 11 beds currently in the ER at Lake City Medical Center.
Right.
And so you're in a kind of a tight space, and if you've got 20 people there, you've got to kind of be a logistics manager, right? Instead of dealing with goods and services, you're dealing with folks.
Most definitely. And anyone who comes to the emergency room, they're hurt and they're in pain. Their problem is just as important as the other person's problem. And so it's difficult sometimes to get people to realize that their medical condition is important to us. However, there may be someone who is life-threatening by their medical condition. So it's definitely logistics. It's definitely a lot of public relations, trying to keep everybody happy, but yet providing good quality care and not missing anything is definitely our goal.
And there's a lot of empathy, right? I mean, because I guess you got to put yourself in the person's situation. If they're having a heart attack, they don't know what's going on, so you've got to be empathetic to their situation, yet still do your job to make sure that you get the best information to the doctor.
Most definitely, and it helps too. Growing up here in this community, everybody that you see in the ER as a patient, you're going to see them eventually, whether it's in the bank, the grocery store. So it's always you have to kind of step back a lot of times and put yourself. You have that one's here maybe for a stub toe, but you know what? It hurts. They're hurting. They want something for pain. To them it's just as important as the person next to them who might be having a heart attack. So you have to really put yourself in their shoes, try to understand what they're going through. But it is a good feeling being able to take care of the people here in the community.
Now, Carl, so we got this guy here that knows how to run an ER, and so now he's told you what he needs. Let's take a look at some photographs. I think we brought some photographs so that folks can see exactly what changes are taking place at the ER. This is an aerial. What are we looking at here?
This is actually an aerial view prior to construction actually getting underway a whole lot. So this is what it looked like maybe early June.
So the top of the photograph where it looks like a little ramp, that's where the ambulances used to go. There was like right there at the top right?
No, actually that's not. The top right that is the back driveway from the ambulance exit. That's where the ambulances did come out instead of go into the ED.
Okay, so now we've got, all right, let's go to the next slide here and see. By the way, Michelle, awesome photographs. This is, there's the old ER. I guess you see at the bottom right of the photograph.
You're absolutely correct. The bottom right of that is where the ambulance came in. To the immediate, it's off the screen, the immediate right of that is actually where the walk-in ED patients, the non-ambulance ED patients walked into the ED for treatment.
Now, so you guys decided to expand, and I would assume this is to the south of, like if the hospital is parallel to I-75, we're looking at I-75 south to the left here, correct?
That is correct. Actually, the expansion kind of goes more to the southwest, but yeah, we did expand out to that direction.
So a lot of planning had to, you lost some parking spaces for employees, a lot of, again, doing it to where it's not going to inconvenience the most folks.
And absolutely correct, because we do have to provide spaces for our employees to park, which is always a challenge with employees and getting them a safe place to park.
And you have to also keep an ER working. I mean, you can't shut down. You have to have ER beds that are continuing to be occupied. Let's go to the next slide, but this is kind of interesting. This is, I'm assuming, a couple months ago?
Yeah, this is probably about 3 months ago. This is kind of some of the early stages where they were putting the new ambulance entrance up. Actually, that's where the ambulance canopy's at. So this will be the new location where the ambulance will drive in and drop patients.
And you guys, you said before we came on the air, this is going to make things easier to get in and out of the ER.
Most definitely, it gives easier access to the ambulance service, gives them with less opportunity to be interfered with by other traffic as they're coming into this area.
All right, let's move on to the next slide. We've got, again, Michelle, these are awesome photographs. That looks like it.
That's a little bit more advanced stage of the ambulance entrance, and to the right, we're putting the new exterior skin on the new construction area where the screen's at. This image is actually where we shut down that walk-in entrance to start the remodel of the walk-in entrance area there. And as you can see, there's a sign kind of in the bottom right-hand corner where we had to direct traffic to the front entrance of our hospital while we had that shut down.
Now, Jody, and there's a waiting room, but what percentage, not everybody comes to the ER through ambulance. There's a lot of walk-in traffic, correct?
We do. We have a lot of walk-in traffic. Only about 13% currently, I think, is what we see for ambulance patients coming to the ER out of our total population.
And I guess this is the new ambulance entrance?
This is kind of what it looks like this week.
Wow. All right, and you've already got landscaping going on there. All right. So we're going to be open here in a couple weeks with the new ER, but you're not going to have the full expansion yet. You're going to have the new part open now. Talk about what happens now. Where are we going? We got still a lot of construction to go to take the old beds out.
You're correct. With the current phasing plan that we're involved in, we have finished the first early phases of the project where we remodeled the walk-in area, the new waiting area, and you saw some images of the new waiting area, which we're very proud of. But the next phase is actually we're going to get the new ED construction area opened around December the 10th. We'll be occupying the new space. As soon as we occupy, within 2 days, we're shutting the old space down and do a total remodel of that space to make it more modern, cleaner, better, prettier. And that particular phase is going to take about 3.5 months. So we'll totally be done with the project somewhere around the end of March, and we'll have a full 22-bed ER fully functional during that time
now,
frame.
What's happening with the old ER? Is it, because you look at 3.5 months, that's not a lot of time, but you guys must have a really good contractor that's working hard.
Well, the infrastructure's there.
Right.
So basically, it's mostly finishes. We're taking out the old nurses station, putting in a new nurses station. We're taking some of the spaces and repurposing them to new spaces where they might have been a storage room before. It will be used for something else in this new phase. All new interior finishes. It's going to be a really pretty space, and it's going to flow very well because our new ED has a new nurses station. Our old ED will still, our current ED will still remain with the nurses station, so it's all got to work together very well so the staff can communicate and manage patients very well from two separate nurses stations. So a lot of the infrastructure with computers and nurse call and all of those devices are going to be updated and integrated together at those two nurses stations.
Now, Jody, now we're talking all new equipment. You mentioned the computer stuff, and so all of this ER in March will be like equipment in all rooms instead of, because I know as you get new stuff, you still have old stuff in there, and now it's like going to be brand new. Everything's going to be brand new, even telemetry and all that stuff that you monitor patients with.
We are. The nurses are very excited. We're going to have all this new equipment to play with. We all love new toys in the ER, but very excited. The rooms look great. They've done a great job with construction and design. And everybody's just really excited to get in there.
Now, Jody, Michelle was telling us before we came on, and one day we're going to get Michelle over here just for payback. But she was talking about the fact that you're going to have to staff this with a little more people because you're going from 11 to 22 beds in the ER. So you're going to have more people. That's the next phase in March, correct?
That is the next phase. We're actually going to look to start hiring around December, end of December, to try to get the new staff trained, get them oriented, up and going, so when we do open up with the 22 beds in March, we're ready to go. Looking at different staffing scenarios, different staffing grids on ways to kind of take care of 22 beds when you may not have 22 beds full at all times.
So we're going to have a 22-bed ER in March of 2015. We talked about this in previous programs, a thing called LifeNet, which is on ambulances in Columbia County. I know that Columbia County, are they on in any other?
The other surrounding counties do have them, Hamilton, Lake Butler.
Let's talk about LifeNet for a second and why state-of-the-art ER and a state-of-the-art ambulance means, or a rescue unit as they say here, is something that you need to think about.
I mean, it's really important when you're in the field for the EMS crew to do an EKG, a 12 lead, which is how you can diagnose a heart attack. When they're in the field, they're able to transmit this electronically directly to the hospital once the EKG has been completed, where the ED physician can determine whether or not this patient is actually having what they call a STEMI, a heart attack, and be able to direct them to a facility that can take care of the STEMIs. Because with your heart, time is tissue. You want to make sure that you're getting intervention as soon as possible.
So this is a new system that's going to be connected to your new ER. It's already
currently
connected,
right,
but it's going to be now where you can really talk to each other, and so that's a great thing for anyone. It should make you reassured that you're going to be hooked up. If you're calling it, and if you're dialing 911 because of chest pains or some other discomfort, there's going to be some diagnosis going on the ride in.
Right. I mean, as soon as they get to you, they're actually able to start the treatment and get you diagnosed and get you to the best place possible.
Now, does this also allow them to say, you know what, this is major, we need to bypass us and go right to a trauma center?
Currently, they are able to. They're able to look at the EKG, determine if it is what we call a STEMI, which requires immediate intervention in a cath lab. Before they even start coming to the medical center, the physician can say, hey, you need to take this patient to North Florida Regional, our sister hospital, or they can have an interventional cardiology assessment done and a heart cath usually.
I want to go back to Carl. Again, we were talking about logistics. How has this been? It seems like this has been a smooth process. There's been headaches that a lot of folks probably didn't get to see. Some folks get inconvenienced. Parking spaces had to be taken away. But in the long run, this is going to be a real benefit to Lake City Medical Center and the patients who go through the ER.
Oh, absolutely. Logistics is always a challenge when you're dealing with new construction or remodeling. We've been very fortunate. We've got a very good contractor that's very experienced in building hospitals, which helped us manage some of the logistics. We also have an excellent ED director. Jody has been very, very gracious in helping us deal with some of the logistic concerns that we have. This whole process, again, is going to make access to the hospital, to the cath lab, talking about the the heart attack patient out in the field. We're also including a cath lab expansion as part of this. We're moving our cath lab inside of the building, As part of that, it's going to allow us to do procedures now that we could not do.
Let's talk a little bit about that, because the ER is where most people present with issues relating to the heart. You know, people don't come in feeling great to say, oh, I need a heart cath. They're under distress. So the medical center has moved the cath lab from off the campus site, from a building behind the hospital, to inside. How has that worked into what you're doing?
Well, it's all part of the bigger scheme of things that we're trying to do to enhance services to the community and bring a higher level of care to the community that we couldn't offer at our hospital in the past. And I'm not a clinician, so I can't talk to the clinical side of it, and maybe Jody can speak to some of that. But what this is going to allow us to do, again, as I said earlier, is provide some procedures that we could not do when the cath lab was in a separate building from the hospital.
So, Jody, I know we talked to Dr. Rourke, and he says that they will be able to do procedures, not just heart caths, but if they need to put a stent in, or if they need angioplasty. This can all be done in Lake City, which has got to be exciting for you, especially being a nurse and the healing process. If you can do it all here in Lake City, folks don't have to drive to visit their loved ones in Gainesville.
Right, and here in the community, that's a big reason people hate to when they come to the hospital. They hate being transferred away. They like being in Lake City, and for us to be able to give them the care that they need, give them the services that they need with the cath lab being here, it's a great addition. We're very excited about being able to do the caths with the stents if they need them. We currently do them now, but if they need any type of stenting, we have to ship them to North Florida Regional for them to take care of it. So in March or December, we'll be able to accommodate them, and it's going to be a good thing for the community.
All right. Now I wanted to, we have a little bit of time left on the program. I wanted to talk about people that go to the ER. They, a lot of them are not in a good mood. They're hurting somewhere. They're not feeling good. They're sick. They've got flu symptoms. And then they go to the ER, and then someone's asking them all kinds of questions. And there's a little impatience sometimes that happen. There's a reason for doing what you do in the ER, Jody. If you'll talk to the folks and let potential patients out there know, you're not just asking them questions to kill time.
No, most definitely. I mean, everything that we ask the patient is something that we need to find out, whether it's to make your care better or to protect us. Especially with the whole Ebola scare going on, we're going to ask some pretty aggravating questions. You're going to hear it over and over again. And that's just where healthcare is going. But you come to the ER, and you're important to us. We know that you're hurting, and we want to give you the best care that we can give you in the quickest amount of time. And a lot of people don't realize that we're actually triaging you. We're looking at your symptoms. We're trying to determine whether or not if what condition that you have going on is something that's going to be life-threatening to you, or is it something that it's going to just take a couple of lab tests and we can diagnose you and send you home. There's constantly people coming in and out, and with HIPAA, you don't know what's going on with the person next to you. So you may see that one person walk in before you get to walk in, and it upsets people sometimes. But I mean, it's definitely we are aware of what's going on. We have to see the sickest patients, get them taken care of, get them stable to where they're not going to be harmed any further from whatever condition they're coming to the ER for.
Yeah, because your situations change constantly in the ER. You may have a couple people with the flu, then you may have someone in a car accident, and you may have someone having a heart attack, and you got to figure out who's the worst off. Right. And again, everybody's important.
Right, and I mean, the nurses are trained to do that. They're trained to do assessments, which would kind of give them a category of severity, whereas one patient may be acuity 5, which is kind of a non-urgent acuity. They don't need any kind of diagnostic test to treat them, and someone who comes in not breathing is a level 1. So you have to prioritize and take care of the ones who need the care the quickest.
Well, I want to say thank you both for being on the program. Jody, I hope I don't see you in the ER. Hopefully I see you out and about in Lake City, having dinner somewhere with some friends. And Carl, I appreciate you coming on and telling us what's happening at the Lake City Medical Center. If you'd like more information on anything about Lake City Medical Center, you can contact the medical center at 719-9000, or you can log on to lakecitymedical.com. Again, new ER, new heart cath lab inside the hospital. Good things happening at Lake City Medical Center. Thank you both for being on the program, and thank you for watching Perspective. Until next time, I'm Mike McKee. So long.